Hello and welcome to Laudio's webcast series and our last session on fostering calm and civility in times of crisis. Leading the conversation and with me today, again, is Dr. Cynthia Clark. Cindy has been a nurse for more than 35 years and is the Strategic Nursing Advisor for ATI Nursing Education. And she's a contributor to Laudio's Frontline Community. Cindy is Professor Emeritus, founder of Civility Matters, the author of Creating and Sustaining Civility in Nursing Education, and an international expert in fostering civility and healthy work environments. In our previous sessions, we discussed what civility and incivility looked like. We've identified ways to foster a thriving, healthy work environment and provided managers with tips to coach civility within their teams. So Cindy, in this session, let's talk about the personal side of crisis and how to manage emotion effectively through them. I have a daughter and a niece. They're both ICU nurses on the front line of treating COVID patients. And you also have a very personal connection to the COVID-19 crisis. So I was just curious to know how you're navigating your own emotions when it comes to your daughter, daughter-in-law, and good friend, and what words of encouragement you can offer others, all of us actually, that are going through this very tough time.
Yeah, thank you. Thank you for asking about that. So I believe all of us with family and friends on the front lines, we're pursuing meaningful ways to cope, not only with them being there, but with us not being able to be with them. And so you mentioned our daughter. Yes, she is a nurse manager stationed with the United States Navy in Atsugi, Japan, and her job is to help manage the COVID-19 crisis among our military personnel. Our daughter-in-law, like yours, daughter Thomas and niece, she is an assistant nurse manager in the ICU, where many patients have tested positive for COVID-19. They've been admitted and sadly, many have died. We've had frequent conversations about nurses and other healthcare workers on the front lines. And in one of our recent conversations, when I asked her how she and her team were doing, she said this: you know, we're pretty frantic at times, but we're learning fast, we're sticking together. I think we've hit our stride, and I'm so proud of our team. And you know, you mentioned my friend of almost 25 years, and by the way, she is also a nurse. She tested positive for COVID-19 about 6 weeks ago and was admitted to the hospital for treatment. At the same time, her husband also tested positive and was admitted to the ICU and was immediately placed on a ventilator. So my friend was told by his physician that her husband would not survive. She was far too ill to visit in the ICU, and even if she hadn't been, there were no visitors allowed in the patient care areas, so she was not able to be with him. And so he died alone, without family, except for the nurses and other workers by his side. And I'm sure many of you have similar stories to tell. And each of us are dealing with this pandemic in our own very personal way. So to manage the myriad feelings and emotions, I find it helpful to check in frequently with those loved ones and provide them a safe place to express feelings and thoughts and concerns. Offering words of support and gratitude can go a long way, not only for those who receive them, but for those of us who deliver them. There's a certain amount of joy that comes from extending kindness and appreciation to those who deserve it. And every day, I believe, is a good day to honor and thank nurses and other frontline workers.
You know, over the past few months, hospitals have become points of isolation and separation for families who have COVID-19 patients. Do you have some advice? You know, how is this impacting frontline workers, you know, who are dealing with families that cannot see or talk to their loved ones, and how can they cope better with that situation?
I think that's such a critical question. And so as a group and as a profession, nurses are compassionate, caring people. We recognize the healing influence of family and other loved ones on patient care, and the healing that brings. So when family members and other guests are disallowed from entering the patient care areas, it not only impacts the patient and the loved ones, but you know what? It impacts the team, the care team. So several organizations are providing resources to help nurses and others craft and deliver caring, supportive messages, which has helped to reduce some of the stress around addressing visitation or no visitation. So as an example, there are organizations that have published guides for nurses that contain several exemplars to deliver a caring message during the pandemic. So if I'm a nurse and I need to let a family member know about a no visitor policy, I might say something like this: I'm sorry that you won't be able to visit your wife today. We have implemented a no visitor policies so that we can keep our patients and our team safe and to keep you from getting sick. So your wife and members of the healthcare team can stay in touch with you by telephone or computer. Let's sit down and talk about some options that we have in order to stay connected.
Amazing. Yeah, that's such great advice. And then any other thoughts you have to help these, brave nurses and their managers better cope with stress?
Tom, I am a big believer in the power of sharing stories and reaching out, supporting one another, because nobody should be doing this alone. It's important, I think, for all of us, whether we're on the front lines or supporting those on the front lines, to take time out, to let others know when we need a break and if we need some support. It's not a sign of weakness to ask for that. It's a basic human need. It's a human condition. It's important to take care of ourselves, to practice self-care, to be involved in wellness activities, to stay as well hydrated as we can, drink lots of water. We've heard, be sure you're getting the rest you need, eating healthy foods, exercising when you can. And I realize that this is really difficult during this time and quite a challenge. But there's a saying by a wellness coach that goes like this, that self-care is how we take our power back. So in the health system where our daughter-in-law works, I mentioned her a little while ago, some of the rooms that were previously designated for patient or for visitors, which now there is not a visitor allowance right now, they're converting those rooms into wellness rooms for self-care, for meditation, and things like that, where nurses can take a few minutes to just sort of restore. Having frequent check-ins with our colleagues can normalize that experience, that it validates and affirms what you're experiencing. Taking time for yourself, we often think, crazily enough, that that's a selfish endeavor, when really it's self-preserving and self-caring to take time for yourself. And I will say this, that if you believe that you are experiencing extreme stress or mental health symptoms, please get support for that from a professional person who can help you process that and help you implement some healthy coping strategies. So as we come to a close with this last of our four-part session, I just want to personally thank all of our viewers, all of the nurses, all the frontline workers, and as I said, those of us who support them, for the incredible contributions you're making during this unpredictable time. And it's often been said, and I don't think it's trite, I think it's true, that we're all in this together. And so for your efforts, for your contributions, we are deeply appreciative. I hope that you, your family, your friends, your colleagues, your loved ones stay as safe and as healthy as possible today and in the future. And Tom, thank you for having me as part of this wonderful series. Take care, everyone.
Thanks so much, Cindy, for these words of advice and being part of Laudio's frontline community. Take care.